Today I rise to present ACR 183 and to begin an important and necessary dialogue. A dialogue on Black health in California and how we have been neglected throughout the state. Black Californians' health hasn't been prioritized, nor have we had access to the necessary resources to curb healthcare inequities. We have been failed by systems that were never designed with our well-being in mind. This isn't just anecdotal, because when we talk about Black health, we are talking about policy decisions. We're talking about generations of purposeful neglect at worst and oblivion at best. We're talking about communities forced to fight for access to the most basic human right, the right to live healthy and dignified lives. And the evidence is undeniable. Black Californians have the shortest life expectancy of any racial group in our state, living on average 5 years less than the statewide average. Black Californians have the highest prevalence of diabetes at 16%. Black men are 44% more likely than white men to be diagnosed with prostate cancer and twice as likely to die from it. Black infants are nearly 3 times more likely to die before the first birthday than white infants. Black women are actually 3 times more likely to die in childbirth than white birthing mothers, regardless of income level. These are not isolated stats. Just this past year, in June, my own father was misdiagnosed. He was told that he had muscle spasms and was given pain medication and muscle relaxers. All the while, he had blood clots, multiple blood clots in both lungs, and he was told that if he did not get to the hospital when he did, my father was dead. And just this past week, we're going to talk about celebrities. Actor Samuel Monroe Jr. was misdiagnosed for 8 months. He's on life support. Now he's off life support. Actress Halle Berry, she was diagnosed with the wrong stage of diabetes. They was told her she had stage 1, but it ended up being stage 2. Just recently, actress Tatiana Ali, she talked about the birth of her son and how her son was pushed back in. And as a result of what happened, he suffered complications and had to be held in the ICU, including her. And then there was Serena Williams, who experienced a near-fatal pulmonary embolism, which was overlooked by staff who suggested that her pain medication was the cause, causing confusion despite her history with blood clots. I'm sharing this with you because these are celebrities, people who have the financial means. So imagine what happens to those who do not have the financial means. These are the consequences of generations of disparities in health access, environmental justice, maternal health care, economic opportunity, and systemic racism. And while we are still fighting to close these gaps, we are now facing federal action that threatens to widen them even further. The passage of HR 1 and the implementation of its burdensome work requirements and 6-month Medi-Cal redetermination will put health care further out of reach for vulnerable communities. 20% of Medi-Cal recipients are Black Californians. These policies will not create healthier communities. They will create more barriers and more preventable suffering. This week is not symbolic. This week for me and for all of us here and for the Black Caucus, it is a call to action. It is a declaration that Black health must no longer be treated as an afterthought in the richest state in this nation. It is a demand that we comfort these disparities with investment and accountability, because behind every member is a family. Actually, behind every number is a family, a mother, a child. A life is cut short. And California cannot claim to lead on equity while the Black community continue to experience some of the worst health outcomes in this state. So this is why today I'm honored to present ACR 183, starting May 4th through May 8th as Black Health Equity Advocacy Week on behalf of the California Legislative Black Caucus. The story of Black health equity in California is still being written. And today, through this resolution, through our votes on health bills and our budget decisions, we have the opportunity to decide how history will judge us. And with that, I respectfully ask for an aye vote.